If we think of knowledge as power, we will want to learn more about these diagnoses. Some may be familiar to you, and others brand new. Either way, listen to these descriptions with the backgrounds of the children in mind. Let's talk about anxiety. All children experience nerves or anxiety at various stages or with certain stressors. But when children experience anxiety as a persistent problem that interferes with their daily activities and makes it hard to function, an anxiety disorder may be considered. Some or all of this anxiety may overlap with traumatic experiences, which we'll also get into. For example, a 12-year-old child not being able to stay in a room by themselves during the day and or not able to fall asleep at night, instead repeatedly getting up to talk to the adults. Now let's talk about depression. Occasional sadness is a normal part of growing up. However, if children are sad, irritable, isolated, or no longer enjoy things, and these moods occur day after day, it might be a sign that they are suffering from depression. Some people think that only adults become depressed, but really, children of all ages and adolescents can experience depression, and studies show that it is on the rise. Read through this list of common symptoms of depression in children and adolescents. Children may also have more physical complaints, such as frequent headaches or stomach aches. Depressed adolescents may use alcohol or other drugs as a way of trying to feel better. For example, a 14-year-old staying in bed with headaches or stomach aches, not able to go to school, teachers reporting a lot of missing work even when a child is in school. Depression can run in families, and of course, there is the life experience of children who have experienced loss, separations, and trauma to be heavily considered because grief and depression can look very much alike, especially when these symptoms come around such events such as holidays, visits with their families, or other reminders of what and who they have lost. We may want to understand these behaviors as a grieving process more so than a diagnosis of depression. When a person experiences a major depression at one time and what is known as mania at other times, it might be diagnosed as bipolar disorder. These are much more significant than typical mood swings and can be a dramatic change from a depressive phase, like being overly happy or overly irritable with a high amount of energy. A child may feel all-powerful like a superhero, or think very quickly, or decrease their need for food or sleep. They may also get involved in very risky activities during this time. For example, a 16-year-old doing daredevil stunts and staying out with different friends until all hours of the night, yet other days not able to leave the house at all, very lethargic and talking about all the bad things happening in their lives. Some of these signs are similar to those that occur in children and adolescents with other problems, such as drug use, or they may have symptoms that match other diagnoses such as attention deficit hyperactivity disorder or disruptive mood dysregulation disorder, which are on our game board so we can understand them too. Many children are irritable, upset, or moody from time to time. However, when children are almost always irritable or angry, or when temper tantrums happen almost every day for over a year in different environments, they may be given the diagnosis of DMDD behavior. For example, an 11-year-old throwing themselves on the floor for long periods several times per week and not getting up until adults stop everything to focus solely on them. For children who have experienced separations, loss, and trauma, outbursts are not uncommon, so DMDD may not be an accurate diagnosis, and it would be important to be sure the medical professional understands the child's life story before treating this diagnosis in a vacuum based solely on their behavior. The symptoms of ADHD have often been confused with the effects of trauma because they have overlapping symptoms of restlessness, sleep disturbances, not seeming to listen well, difficulty concentrating, and/or disorganization at home or school. These are also overlapping symptoms of being exposed to drugs and alcohol in utero, so it will be important for the treatment team to address all the causes rather than just treating ADHD.